Hello, dear friends. It's Dr. Sarah, and today I want to talk to you about when histamine gets too high and mast cells go haywire. Can essential oils help with this? Do these symptoms sound familiar to you? Sneezing, running noses, digestive distress, food sensitivities, brain fog, fatigue, cyclical pain, hives, skin irritations, menstrual issues, inflammation, fluid retention, headaches, and all other basically things that you can think about that would cause bodily or emotional woes. If you answered yes to more than several of these symptoms, you may be among the many people that are struggling with excess histamine in their body. So what I want to do in this video is share with you what happens when too much histamine overwhelms your body. I also want to introduce to you how essential oils be a key modality to include in a wellness protocol to assist with its balance. So we're going to discuss what is histamine, what are mast cells, what is histamine intolerance, what is mast cell activation syndrome or MCAS, why is histamine overreaction on the rise, and how essential oils can help with balancing histamine. In an upcoming video, I'm going to dive deeper into using essential oils for histamine balance, give you some more specific oils, and discuss how they impact immune resiliency in general. Now, as always, all the references in the articles and the studies will be available in the resource section, as well as in the links in the accompanying post. So we'll go ahead and get started. What is histamine? What are mast cells? Because the two are linked. Well, first of all, histamine is getting a lot of press lately, but it is not the bad guy. It is a natural immune modulator, and it's a chemical signal for regulating things such as digestion, for sleep, mood, heart rate, hormones, and various bodily processes. It is such an important molecule. It's synthesized in several immune cells. We have your mast cells, your basophils, your eosinophils, and histaminergic neurons, and in our gastrointestinal tract. It's a natural vasodilator, so it results in an inflammatory response. And histamine effects are so widespread because their receptors exist on the gut and the skin and respiratory tissue and the nervous system and in the reproductive tract, to name a few. Now, mast cells are immune cells that release histamine and many other chemical mediators. They also play a central role in your defense of foreign substances and are often associated with allergies and anaphylactic reactions. They play a role in immune activation, autoimmunity, and increased inflammation as well. Mast cells are on the border of almost all your organs because they are one of the first responders to threats. They are especially populated again in the skin, in the gut, in the lungs, in the sinuses, in the nervous system, and in the reproductive tract. Now, histamine is a major chemical compound that's often associated with mast cells, but they also spew out a bunch of other mediators that can cause havoc in the body. These include tryptase, chymase, interleukins, prostaglandins, cytokines, chemokines, and proteases. Now, normally the body can use these biochemical signals to initiate a response and to heal. We need inflammation when there's something in the body because inflammation actually helps our body heal from the process, bring in all these white cells, clean up the debris, and then create a healing tissue response. But when these chemicals linger and stick around too long, they can trigger even more late phase and systematic effects. We all know what happens when inflammation goes on too long or we get chronic stress responses. The body tends to kind of break down in its resiliency. So, and specifically when histamine levels get too high, it can cause histamine intolerance and it can be part of the mast cell activation syndrome or MCAS. Now, both conditions are related to when your body is not dealing well with balanced histamine levels. This means there can be an overproduction of histamine, problems with eliminating or metabolizing it correctly, or there can be some sort of external factor that's continuing to trigger it. This can be environmental, it can be pathogens. We think about things such as mold or Lyme disease or some of the co-infections. And all of these can be causing the immune system to go into disarray and cause some dysregulation. So now that we know what histamine is, that it's a chemical mediator, that we know about mast cells and what they do and what they release, and that they're all part of the body's natural processes for regulating various functions and for helping our immune response, what happens when they're too much, right? And in the first instance, let's talk about histamine intolerance. So histamine intolerance occurs when the body cannot properly break down histamine. It can lead to a wide range of symptoms, some of which we already discussed, but just to review, some of them include allergies, congestion, headaches, hives, skin issues, fatigue, digestive problems, blood pressure changes, flushing, vertigo or dizziness, hormonal imbalances, and asthma attacks. High histamine levels are often the result of having a slower enzyme activity that breaks it down, or lower amine oxidase activity. And this can be due to genetics, can be due to nutrient deficiencies to make that enzyme run effectively. It can be related to excess immune triggers, metabolic issues, environmental exposures, pathogen, and some other factors that can be underlying triggers of immune dysregulation and histamine response. Diamine oxidase, or DAO, it's actually on the market now. You can purchase that, but that's often the key enzyme that is compromised when we're thinking of ingested histamine. So slow or low levels of DAO can often lead to food sensitivities and digestive issues. Okay, what about MCAS, or mast cell activation syndrome? This is an immune disorder and a type of mast cell activation disease. Unlike other forms, MCAS does not involve excess mast cells or infection. It's more of a overreaction of the mast cells and a malfunction. And it can result in many of the symptoms related to histamine intolerance and more widespread over exaggerated responses to just typical environmental cues, to supplements. The person is over responding or creates exaggerated responses to different things that they're exposed to. And oftentimes these are the people that have the paradoxical results when you give them integrative treatment. So they could be negatively responding to, say, glutathione, which is supposed to be helpful in helping the body detox, or they could take a B vitamin and it could actually make them worse, not provide more energy or help them with specific problems in blood sugar regulation. So this is a very debilitating condition and it's very complex. So we know, though, recently that more people are getting interested in histamine intolerance, and MCAS. And I have noticed this with more of my clients and my loved ones who tend to be more reactive to environmental triggers than they were in the past. In fact, many of my clients have been reporting their experience hiding symptoms, and they have more robust allergic responses. Especially lately, it's been to bee stings or to wasp. The histamine responses have been pretty profound in them. Menstrual issues, gut disturbances, skin eruptions, mood shifts are common, allergic reactions, sleep issues. All of these can be related to heightened histamine. And oftentimes these concerns have been kind of linked to maybe just one thing, but when we put them all together, it's the patterns of that this is all related to histamine that someone can tell. And many of my fellow integrative practitioners are also reporting similar findings in their patient or clientele and these exaggerated symptoms. And many of them feel that it's related to a rise in the level of environmental toxins that we're up against. So our immune system is just constantly seeing foreign invaders and creating a defensive response, can't really let down because it just keeps coming at us. And then we have any excessive physical stressor, but also emotional stressors as well, all the stress we've been through in the past few years. And then there's also, if we look at the fact that there's been more of an increase in the spike protein around the world, and mold can come out, especially in New England. That's been another key area, especially that I've been seeing more people impacted by mold with the dampness and all the weather fluctuations and the floods. All of these create high histamine responsive and highly reactive mast cell responses. So I think these could be some of the reasons why more people are experiencing these exaggerated responses, getting sicker more often, and also having some of these more profound issues with getting resolution quickly. So treatment can be complicated for both of these, and it's something that's someone should see a professional about that has some knowledge in how to treat both histamine intolerance and mast cell activation syndrome. But one of the first steps is symptomatic relief, and this can often include over-the-counter antihistamine medications. And some of the most common ones used, say, are like Pepcid or over-the-counter Claritin. This can actually help to bring the histamine levels down, and then that in combination with calming the limbic system through different neural training programs, because the body is in such a overreactive state that everything it sees is coming in as danger and it can't heal. So until those two things are down, it's hard to help the body heal. Now, in any of these phases of histamine excess, I have seen with my clients where essential oils can be helpful. And this is because they have the potential to harmonize various aspects of the immune system, and they can also influence histamine and mast cells. They can directly also interact with our limbic system. We know that our sense of smell directly goes to the emotional center of the brain, including the amygdala and the limbic system. And this can calm the fight and flight and survival mode and kind of help a person process things and deal with what they're up against in the environment. At the same time, essential oils have many biochemical properties that help with the underlying issues relating to the continual response of the inflammatory process, the high levels of toxins in the environment, etc. So they can aid in supporting histamine signals in the various organ systems. And in the next part of this video, we can discuss that a little bit more about different essential oils and how they exactly do that, which is going to be a lot of fun. But in order to do that, I just wanted to provide some basic information, especially for my clients out there, because in this way, we can kind of condense it all in one, give you some basic information about what's going on with a lot of you today, where before lifestyle recommendations and supplements and all that tended to work for you and resolved fairly quickly. But because of what we've been up against with all the stressors and environmental toxins and all of this compound stress, I think more people are getting a highly reactive immune response. Histamine is not the bad guy, but it is one of the things that can go on the rise when our body is overstressed. So I hope that that was helpful for you, and I'd love to hear your experience. And if you've had any history of addressing histamine intolerance or MCAS, if you've gone through it, if you've used essential oils, I would love to hear from you on all of that. And I want to thank you for taking the time to learn more about this important topic and how essential oils might be a good addition to help you be proactive in your healthcare to this condition. So more on this in part 2. Be sure to subscribe to my YouTube channel and my newsletter so you know when that drops and you don't miss it. And I will talk to you again real soon. Many blessings and take gentle care.